Have you ever experienced persistent itching in unexpected places like your legs, neck, chest, or hands? It's a common issue, especially as we age, but understanding the causes can be tricky. In this video, we'll explore 5 areas where itching can be a sign of something more serious, from poor circulation to nerve issues and even organ health. By watching until the end, you'll not only learn how to identify the underlying causes but also gain crucial tips for managing these symptoms and maintaining your well-being as you age. Don't miss out. This information could make a real difference in your health. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. 1. Lower legs and feet. Persistent itching in the lower legs and feet is a common issue that many individuals face, particularly as they age, and it is often a sign of underlying circulatory problems. As people grow older, their circulatory system tends to weaken, leading to a decrease in the efficiency of blood flow to the extremities, including the legs and feet. This reduced circulation can manifest in a variety of ways, one of the most common being dry, itchy skin. The skin in these areas may feel uncomfortable, and this itching can sometimes be accompanied by noticeable swelling, pain, or a general sense of discomfort. One significant condition that can contribute to this type of itching is peripheral artery disease, PAD. PAD occurs when the arteries in the legs become narrowed or blocked due to the buildup of plaque, which restricts blood flow. This reduction in circulation can result in a variety of symptoms, including itching in the lower legs and feet, as well as changes in skin texture, such as dryness, discoloration, or even the development of sores or ulcers that may heal slowly. The reduced oxygen and nutrients that reach the skin due to poor circulation can cause the skin to become fragile and irritated, making it more prone to itching. Additionally, swelling may occur as blood and fluid accumulate in the extremities, further adding to the discomfort. In many cases, the sensation of itching in the lower extremities can also be linked to diabetes, which is a prevalent condition among older adults. One of the complications of diabetes is diabetic neuropathy, which occurs when high blood sugar levels over time cause nerve damage. This damage can lead to a variety of sensations, including tingling, numbness, and in some cases, persistent itching in the feet and lower legs. This neuropathy is typically felt in the feet first, but it can extend up the legs as well. The nerve damage can disrupt the normal functioning of the skin's sensory systems, making the skin feel itchy or irritated without any visible signs of inflammation or infection. Furthermore, diabetes can also interfere with the skin's ability to retain moisture. This can lead to excessively dry skin, which is more susceptible to cracking, flaking, and irritation. When the skin becomes dry and cracked, it can worsen the itching sensation, creating a vicious cycle that is difficult to break. The itching may be especially intense during colder months when the air tends to be drier, exacerbating the condition. In some cases, individuals may scratch the affected areas in an attempt to relieve the itching, but this can often lead to more harm than good. Scratching can damage the skin, causing cuts, abrasions, or even small open sores, which can increase the risk of infection. When the skin is damaged, it becomes more challenging for it to heal properly, further prolonging the discomfort and increasing the likelihood of complications such as infections or the development of sores that do not heal easily. To address these concerns, older adults need to engage in regular checkups with their healthcare provider. Routine visits are crucial for monitoring circulation and for managing any underlying conditions such as diabetes, high blood pressure, or high cholesterol that could contribute to circulatory issues. Your healthcare provider may recommend a variety of strategies, such as lifestyle changes, medication, or specialized treatments, to improve blood flow and alleviate discomfort. In some cases, a treatment plan may involve taking medications to improve circulation or reduce inflammation, or physical therapy to help increase blood flow to the extremities. Additionally, for individuals diagnosed with PAD or other circulatory issues, it is essential to take proactive steps to improve circulation. Regular exercise, such as walking or other low-impact activities, can help keep the blood flowing and reduce symptoms. Compression stockings, which are often recommended for individuals with circulatory problems, can also help alleviate swelling and discomfort by improving blood circulation in the legs. Additionally, maintaining a healthy diet, staying hydrated, and moisturizing the skin regularly can help prevent dryness and reduce itching. 2. Back of the neck. Itching on the back of the neck, while often a minor nuisance, can sometimes be a signal of more significant health issues, particularly those related to nerve function and spinal health. One of the most common conditions associated with this type of itching is cervical spondylosis. Cervical spondylosis refers to the natural wear and tear of the spine as people age, which can cause the discs and joints in the cervical neck region to deteriorate. This degeneration can lead to nerve irritation or compression, causing abnormal sensations such as itching, tingling, or even numbness in the back of the neck or the surrounding areas. These sensations occur when the spinal structures, including the discs, bones, and ligaments, place pressure on the nerves that emerge from the spinal cord. As the nerves become irritated or pinched, the result is often a discomforting, persistent itching sensation. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. Another significant factor contributing to neck itching is poor posture, especially when an individual spends long periods sitting or standing with their spine out of alignment. When the spine is misaligned, especially the cervical vertebrae, it can place undue pressure on the nerves, leading to a variety of symptoms including itching, tingling, or even pain. The stress on these nerves is often exacerbated when the body remains in a fixed position for long stretches, leading to poor blood circulation and nerve strain. Degenerative disc disease, a condition where the intervertebral discs in the spine lose their ability to act as effective shock absorbers, can further aggravate nerve irritation. When these discs lose their flexibility, height, or cushioning abilities, it can result in the narrowing of the space between vertebrae, which in turn puts pressure on the nerves exiting the spine. This pressure can lead to the sensation of itching or tingling, particularly in the back of the neck and radiating into the shoulders or upper back. In addition to spinal and nerve-related causes, the skin on the back of the neck itself can also contribute to the feeling of itching. The neck skin is sensitive and can be easily irritated by contact with clothing, particularly if the person wears tight collars, scarves, or straps. Individuals who have dry or eczema-prone skin may find that their skin becomes irritated more easily, especially in the presence of friction from clothing or environmental factors such as humidity or temperature extremes. Eczema, psoriasis, or other dermatological conditions can exacerbate itching when combined with skin sensitivity, leading to an itch that feels more intense and persistent. If the itching on the back of the neck is persistent or occurs alongside other troubling symptoms, such as pain, stiffness, restricted movement, or muscle weakness, it may indicate that the problem is more serious and related to a spinal or nerve condition. In such cases, it's essential to seek medical evaluation promptly. Conditions like nerve impingement, herniated discs, or inflammation of the spinal structures can lead to progressive symptoms if not addressed early on. A healthcare provider can help identify the underlying cause of the symptoms, which may involve physical examinations, imaging tests, or other diagnostic procedures. Early diagnosis and treatment are key to managing spinal health and avoiding more severe issues down the line. Therefore, anyone experiencing persistent or worsening neck symptoms should not delay seeking professional medical advice to ensure proper care and management of the condition. 3. Chest and upper torso. Itching in the chest and upper torso can be an annoying and unsettling sensation, and in some cases, it may serve as a sign of potential underlying health problems, particularly as we get older. One of the most important possibilities to consider is the connection to cardiovascular issues. Conditions like heart disease, high blood pressure, or even poor circulation can significantly impact the flow of blood to the skin. As we age, the heart's efficiency in pumping blood may decrease, or blood vessels may become less flexible, which can impair circulation. When blood flow is restricted, it can lead to dryness and irritation in the skin, which may present as itching in areas such as the chest and upper torso. The skin, deprived of the necessary nutrients and moisture from a healthy blood supply, can become more vulnerable to dryness, roughness, and itchiness, particularly in sensitive areas. Another common condition that might contribute to itching in the chest and upper torso is pruritus, a term for generalized itching that occurs without an obvious rash. This type of itching can be a symptom of more systemic health issues, particularly liver or kidney disease. When the liver or kidneys are not functioning optimally, they may struggle to filter out waste products or toxins from the bloodstream, leading to the buildup of substances that can cause skin irritation. This type of itching often occurs throughout the body but may be more noticeable in certain areas, including the chest, and tends to persist or worsen over time if the underlying condition is left untreated. Pruritus is often seen as a secondary symptom of liver or kidney problems and may indicate the need for medical attention to assess organ function and overall health. Beyond cardiovascular and organ-related issues, other factors can contribute to itching in the chest and upper torso. Allergies and adverse reactions to medications are common culprits. Certain medications, particularly those used to treat heart conditions, blood pressure, or cholesterol, can have side effects that affect the skin, leading to itching. For some individuals, allergies to food, environmental factors, or substances like fragrances, lotions, soaps, and even laundry detergents can trigger allergic reactions, which may cause itching in localized areas like the chest or upper torso. These allergic reactions can result in irritation, rashes, or other skin discomforts, and it's crucial to identify and avoid triggers to reduce symptoms. The chest is a particularly sensitive area due to its proximity to vital organs such as the heart, lungs, and major blood vessels. Persistent itching in this area should not be dismissed, especially if it is accompanied by additional symptoms that could signal more serious health problems. Symptoms such as shortness of breath, fatigue, swelling in the extremities, changes in the color or texture of the skin, or any chest discomfort should be taken seriously and assessed by a healthcare professional. These could be signs of a cardiovascular issue, fluid retention, or another systemic concern that requires immediate attention. Early detection and intervention are key to addressing any potential underlying health conditions and preventing further complications. If the itching becomes persistent, unexplained, or is accompanied by other concerning symptoms, it is essential to seek medical advice. A healthcare provider can conduct a thorough evaluation, including a review of medical history, possible allergies, and diagnostic tests to determine the cause of the itching and recommend appropriate treatment or lifestyle changes to alleviate the discomfort. 4. Hands and wrists. Persistent itching in the hands and wrists is not just a minor irritation. It can be an indication of several underlying health issues, many of which are related to joint, nerve, or skin conditions. This type of itching can manifest for various reasons, and it's important to understand the potential causes so that appropriate steps can be taken to address the issue. In older adults, one of the most common causes of itching in the hands and wrists is arthritis. Osteoarthritis, a degenerative joint disease that primarily affects older individuals, often impacts the hands and wrists. Along with the typical symptoms of osteoarthritis, pain, stiffness, and limited mobility, itching can develop as a result of inflammation. When the joints are inflamed, the skin surrounding them can become irritated, which leads to persistent itching. This can be particularly frustrating because it often occurs in tandem with the discomfort of joint pain and stiffness, making the symptoms more bothersome. In addition to arthritis, nerve-related issues can also contribute to itching in the hands and wrists. Carpal tunnel syndrome, for example, is a condition that involves the compression of the median nerve, which runs through the wrist and into the hand. When this nerve becomes compressed, it can result in a range of symptoms, including itching, tingling, numbness, and weakness in the hands. The sensation of itching, although less commonly discussed than tingling or numbness, can be an early warning sign of nerve involvement in the wrist. As the pressure on the nerve increases, the discomfort may intensify, potentially leading to more severe symptoms that require medical intervention. Beyond joint and nerve-related issues, skin conditions are another common cause of itching in the hands and wrists. Dry skin is particularly prevalent in colder weather or environments with low humidity, both of which can strip the skin of its natural moisture. Dryness can cause the skin to crack, peel, and itch, often leading to further irritation when scratched. This condition is typically temporary and can be managed with moisturizing treatments. But if the skin continues to itch despite hydration, other underlying causes may need to be explored. Eczema, a chronic inflammatory skin condition, can also affect the hands and wrists, causing red, itchy rashes. Eczema may flare up due to environmental triggers or stress, and the constant scratching can worsen the rash, creating a cycle of irritation and inflammation that can be difficult to break. Allergic reactions are another possibility. Certain soaps, lotions, or even medications can trigger localized allergic responses. These reactions may lead to itching accompanied by redness, swelling, or even hives. It's important to keep track of any new products or substances that have been introduced into one's routine to identify potential allergens. In some cases, the health of the skin is influenced by what's happening inside the body, particularly when it comes to nutrition. A diet that lacks essential nutrients, such as omega-3 fatty acids, vitamin E, or other vitamins important for skin health, can lead to dry, irritated skin that is more susceptible to itching. Omega-3 fatty acids, for example, are vital for maintaining the skin's natural moisture barrier, and a deficiency can result in skin that is not only dry but also inflamed. Similarly, insufficient hydration can exacerbate dryness and make itching worse. Ensuring adequate fluid intake and a balanced diet rich in essential nutrients can help improve skin health and reduce discomfort. If the itching in the hands and wrists is accompanied by other concerning symptoms, such as noticeable swelling, weakness, numbness, or intense pain, it's essential to seek medical attention promptly. These additional signs could indicate a more serious underlying condition, such as a nerve issue, an autoimmune disease, or even the advanced stages of arthritis. In these cases, a healthcare provider will be able to perform diagnostic tests, such as blood work, imaging, or nerve studies, to determine the root cause of the symptoms. Once a diagnosis is made, treatment options can be explored, which may include medications, lifestyle adjustments, physical therapy, or other therapies designed to manage the condition and alleviate the discomfort. Early intervention is key to preventing further complications and improving the quality of life for those affected. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 5. Lower back and hip region. Itching in the lower back and hip region is a symptom that should not be dismissed, as it can indicate a variety of underlying health issues. This discomfort can be particularly concerning in older adults, who may be more vulnerable to certain conditions that affect the kidneys, nerves, and skin. One of the most common and potentially serious causes of itching in these areas is related to kidney dysfunction. The kidneys play an essential role in regulating fluid balance, filtering waste from the blood, and eliminating toxins from the body through the urinary system. When the kidneys are compromised, either due to chronic kidney disease or acute kidney failure, their ability to remove waste and toxins effectively is impaired. As a result, toxins and waste products can build up in the bloodstream, a condition known as uremia. Uremia often manifests as intense and persistent itching, commonly in the lower back, hips, and other parts of the body. This type of itching, known as uremic pruritus, is particularly common in individuals with advanced stages of kidney disease and should be taken seriously. Another factor to consider when experiencing itching in the lower back and hip region is nerve-related issues, particularly those that affect the spinal cord and nerves in the lower back. Conditions like sciatica, herniated discs, or spinal stenosis can lead to nerve compression or irritation, causing discomfort and abnormal sensations in the hip and lower back areas. Sciatica, which occurs when the sciatic nerve is compressed or irritated, often causes sharp, shooting pain, but it can also lead to tingling, numbness, and itching that radiates from the lower spine down to the hips and legs. Spinal stenosis, a condition characterized by a narrowing of the spaces within the spine, can exert pressure on the spinal cord and nerves, leading to similar symptoms of tingling, pain, and itching in the lower back and hip regions. These conditions can worsen over time if not properly managed, making it important to seek medical attention if nerve issues are suspected. Diabetes is another important consideration when discussing the causes of lower back and hip itching. Many individuals with long-standing diabetes develop a complication known as diabetic neuropathy, which involves nerve damage due to prolonged high blood sugar levels. Diabetic neuropathy can result in a range of sensory disturbances, including tingling, burning, numbness, and itching, especially in the lower back, hips, and legs. As the nerves become progressively damaged, the body's ability to send proper sensory signals to the brain becomes compromised, often leading to uncomfortable and abnormal sensations. Individuals with diabetic neuropathy may experience itching as part of the nerve dysfunction, especially if the condition is not well controlled. In addition to internal health conditions, external factors such as skin conditions can also contribute to itching in the lower back and hip area. Chronic skin conditions like eczema, psoriasis, and fungal infections can cause significant irritation and discomfort. Eczema, a condition that leads to inflamed, red, and itchy skin, is often triggered by factors like dry weather, irritants, or stress. Psoriasis, another chronic inflammatory skin condition, results in the rapid growth of skin cells, leading to thick, scaly patches that can become itchy and inflamed. Both eczema and psoriasis can affect the lower back and hip areas, particularly if the person's skin is prone to irritation from clothing, sweat, or friction. Fungal infections, such as athlete's foot or ringworm, thrive in warm, moist environments and can cause itching, redness, and irritation, often in areas like the folds of the skin. These types of infections are more common in individuals with limited mobility, as sweat can accumulate in skin folds, increasing the risk of fungal growth and irritation. If the itching in the lower back and hip area persists or becomes severe, it's crucial to seek medical evaluation to identify the root cause. A healthcare provider may perform tests to assess kidney function, such as blood and urine tests, to check for signs of kidney disease. If nerve damage is suspected, imaging studies like X-rays, MRIs, or CT scans may be ordered to evaluate the spine and surrounding nerves for conditions such as herniated discs or spinal stenosis. Additionally, the doctor may examine the skin for signs of eczema, psoriasis, or fungal infections, which can often be diagnosed with a physical exam or a skin culture test. Timely diagnosis and treatment are essential for addressing underlying health concerns, whether related to the kidneys, nerves, or skin, and to prevent the condition from worsening or causing further complications. Thank you so much for joining us in this video on the causes of persistent itching and what you can do about it. We've explored key areas where itching could be a sign of something more serious, like circulation issues, nerve problems, and even organ health, especially as we age. So, what have you learned so far? Take a moment to reflect on the important takeaways from this video. What's one thing you've learned that you plan to bring into practice in your own life? Drop your thoughts in the comments below. If you like this video, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more helpful content. Stay informed and stay healthy.